Dr. Manish and Ankita Shah. Thank you all from the Hindi part. So now this is the 1345th day of uninterrupted daily webinar of IFPH International Forum for Promoting Homeopathy. So we are uninterrupted continuously. We are sitting here and this platform is going indefinitely, infinitively, I think that. So today our guest is Dr. Balachandran. Let us have an 1 minute silent prayer before starting the session. Thank you all. Professor Dr. Balachandran, MD, Pediatrics in Homeopathy, Senior Medical Officer, Homeopathy AIM, Patna, former Professor and HOD of Department of Practice of Medicine, RKDF University, Bhopal, and today is dealing the subject importance of biochemic medicines in practice, part 2. He done almost so many classes here in all sessions in Hindi, English, and we have much experience from him, good experience. Each and every time he's giving and depth in science and importance of other medicines, and his within this in his young age he attained a great knowledge and great wisdom, and that is great because these are all we are very much blessed of hearing such classes from very important veterans. So thank you all. We expect a very nice presentation today. Dr. Yua, welcome to our platform. Then we know that for 45 minutes our class, then there will be a discussion part. So you give time for that also. Thank you, Doctor. You can welcome. You are most welcome to our platform. You can start now.
Thank you, Dr. Hubert De Silva, sir, and good evening, one and all. Let me get to the session of today's class. I'm sharing my screen.
Yeah, you can do, sir.
Just give me a reciprocation if the screen is visible and my voice is audible to you all.
Yeah, it is good.
Okay. So this is the second session of importance of biochemic medicines in practice. The previous session was taken probably on February of this year, and this is the second session regarding the medicines of biochemic medicines, what we will see today. Right? As you know, there are 12 biochemic medicines, and I hope you know the name of it also. If not, I will share with you the name of these medicines. So these are the names of the 12 tissue remedies. We have the fluoride of lime called the Calcarea fluor. We have phosphate of lime called the Calcarea phos. We have sulfate of lime called Calcarea sulf. We have phosphate of iron called ferrum phosphoricum. Chloride of potash called Kaliumuriaticum. Phosphate of potash called Kaliphosphoricum. Sulfate of potash called Kalisulfuricum. Phosphate of magnesia called Magnesium phosphoricum. Chloride of soda called as Natrium muriaticum. Phosphate of soda called as Natrium phosphoricum. Sulfate of soda called Natrium sulfuricum. And last is silicic acid, which is called as silicea. But there's a disclaimer regarding this. If you see the recent books on the tissue remedies or the biochemic medicines, you can see only 11 medicines. There are not 12. One has been omitted by Dr. Schuessler in his last years before his death, and that was sulfate of lime, Calcarea sulf. Calcarea sulf has been omitted from his list of 12 tissue remedies because he thought that sulfate of lime or Calcarea sulf is not having much more function, except that it is going to remain in the liver trying to perform the reticuloendothelial function, or nothing but the destruction of the senile RBCs. It is going to help in that function. So he thought that it is not of much importance. So he neglected sulfate of lime or the Calcarea sulf from the 12 tissue remedy list just before his death. So you might not be excited to find out or shocked to find out that the recent text what we have is having omission of sulfate of lime or Calcarea sulf. But I have included sulfate of lime here because in his earliest texts, the sulfate of lime is available, and we do use Calcarea sulf as a separate biochemic medicine in our practice on certain indications. So I thought rather than omitting that on base of new textbooks, I thought of including the same I'm trying to explain you the functions what sulfate of lime has apart from this function, right? Now let's go to the further slides. This has been completed in the previous session. I'm switching directly to this. Now, the best way of studying biochemic medicines is by a group study. Normally, in homeopathy, we study the medicines depending upon the groups, right? There are groups of vegetable kingdom, mineral kingdom, nosodes, sarcodes. And in vegetable kingdom, we have Solanaceae family, Anacardiaceae family, Ranunculaceae family likewise. And in mineral kingdom, we have the calcium group, we have the magnesia group, we have the Kali group, we have the natrium group. Likewise, we have the different groups, the carbon group likewise. So in this way, we study the group remedies, the group study of homeopathic medicines. Here, I have adopted a different types of group study for the biochemic medicines. I have clubbed them under the head of anions. I told you the salts are having two parts. One is the cation, second is the anion. The cations are the sodium, the calcium, the magnesium, the potassiums. Okay, all these are the cations, and the anions includes the substrates, that is the phosphates, sulfates. Okay, all these comes under the muriaticums, the chlorides. All these comes under the anion part. So I thought of classifying or grouping the biochemic medicines on the basis of the anion components because they are having certain similarity when we study based upon the anion component. So the first group study what we have for studying this biochemic medicines is the phosphate group. So we have the 5 phoses coming under the phosphate group. One is the ferrum phosphate or the ferrum phos. Second is the kali phosphate or the kali phos. Third is the natrium phosphate or the natrium phos. Fourth is the calcareous phosphate or the calcium phos. And fifth is the magnesium phosphate or the mag phos. Now, why I have grouped this under the phosphate is because in the market, if you see, this is available as the 5-phos tablets. This is a combination whereby you have the 5 phoses present as a single triturated tablet, which has all the components of the 5 phoses. Ferrum phos, kali phos, natrium phos, calcareous phos, and magnesium phos together. And we have the 5-phos tonic also available, which is having the clubbing of all the 5 phoses together. Now, why they have selected these 5 phoses alone in the combination of either the ferrum phos, the 5-phos tonic, or whether it is the 5-phos tablets, because it is having certain synergistic action, which can complement the patient's healing process. So here we will study these 5 phoses together first. What we want to know is the pathogenesis, how this tissue salts, when there is going to be a derangement in the dynamic equilibrium or the dynamic rotation of this particular salts, if this is going to get deranged, then there is going to be resultant diseases. So that pathogenesis is very important to understand the salts. But anyway, we'll start with the location, right? First, if you see the ferrum phos alone, the location of ferrum phos or the iron phosphate is present in the hemoglobin. Okay, and it is even present in every cell. The organic basis of every cell is made up of albumin, and every albumin contains iron. So we can say otherwise that every cell is made up of iron because every cell contains albumin. That's why. And when you see the functions of ferrum phos, the function of ferrum phos is it is going to act as an oxygen carrier. It is not going to perform the function alone. It is going to perform the function along with one more salt called as the kali sulfate or kali sulf. Okay, so ferrum phos and kali sulfate together is going to perform the function of an oxygen carrier wherever it is going to be present, whether it be hemoglobin in the heme part of the hemoglobin, or whether in every cell wherever albumin is present, the iron is going to perform the function as an oxygen carrier along with the help taken from potassium sulfate or kali sulfate. Okay, so if you see the pathogenesis, how the disease happens, we should start from this. If there is going to be a disturbance in the molecular movement of ferrum phos, then it leads to relaxation of the muscular fibers. Because of relaxation of the muscular fibers, there is going to be congestion in the blood vessels, that is stagnation of the blood because of relaxation happening. Okay, and the second thing is the relaxation of muscular fibers can lead to either constipation or diarrhea, either or both. Okay, now why constipation? Because if there is going to be relaxation in the muscular fibers, then what happens? There is going to be reduced peristaltic movement. When the peristaltic movement is getting reduced, there will be stagnation of feces. When the feces is going to not move and remain in one place, what happens? Excessive water absorption will take place through the intestinal villi. When excessive water absorption takes place, what happens? The stool becomes dry. When the stool dries up and the stool is going to remain in one place and the peristaltic movement is going to get reduced, now what happens there? Then that results in a condition called as constipation, right? So this is how the pathogenesis starts up. Okay. So this is how the disturbance in the molecular motion of ferrum phos can lead to constipation, right? And if you are going to see in the next group, that is the caliphosphoricum, that is caliphos. If you see the location, it is located in all the animal fluids. Animal fluids includes what? The sweat, saliva, the milk, breast milk, human breast milk, the cerebrospinal fluid, okay, the blood, okay, the interstitial fluid, the serum, the plasma, okay, in all these, the urine, in all these animal fluids, this particular, the sperm, even the cervical secretions, in all these animal fluids, caliphosphoricum, that is potassium phosphate, is there. Okay, and it is present in tissues such as brain, such as nerves, such as muscles, and such as blood cells. It is present in all these tissues even. Okay, if you see the function of caliphos, the function of caliphos is that it is indispensable for the formation of tissues. So if there is going to be tissue building, the tissue building will only happen with the help of caliphos along with other essential proteins required for the formation, or amino acids required for the formation of the particular tissues. Okay, so if you see the pathogenesis of caliphos, if there is going to be a disturbance in the molecular motion or molecular movement of caliphos in any of these locations, then it can lead to resultant action or resultant effects in three areas. One is in the mental plane or mental sphere, whereby because of the disturbance in molecular motion of caliphos, there is going to be anxiety, bashfulness or shyness, there is going to be a fear, a lachrymose or weeping mood, okay, a suspicion, homesickness, weak memory, and depression kind of symptoms. So these will be the symptoms present in the mental plane. Why? Because caliphos is present in tissues of brain as well as the nerves. So if there is going to be disturbance in the molecular motion of caliphos and the brain or the nervous tissues, then that results in mental changes like anxiety, bashfulness, fear, lachrymose condition or the weeping mood, suspicion, homesickness, weak memory, depression kind of symptoms. And if you see the sensory physical plane, if you see the sensory aspect of the nervous system, you know the nervous system consists of two parts, right? One is the motor nervous system, second is the sensory nervous system. Sensory nervous system carries the sensation and motor nervous system carries the motor functions or the movements, right? So if you see the sensory plane or sensory nervous system, you can see there is going to be a paresthesia or paresis. Paresis means what? The nerve system is almost not completely paralyzed, but it is in a stage of ongoing progressive paralysis. So in this case, if the sensory nervous system is going to get a paresis, then the symptoms which would be cropping up would be kind of paresthesia. Paresthesia means what? A kind of altered sensation. You can find numbness, you can find tingling kind of sensation. Okay, so all these kinds of sensations are sometimes lack of sensation, which is called as anesthesia. Okay, or altered heat and cold sensation, that is called as thermal paresthesia. Okay, so these are the symptoms which the patient would feel if the sensory nervous system is going to get affected. The symptoms what I have stated all. And next is the motor nervous system. If there is going to be a motor nervous system, there is going to be again paresis, which ongoing can result in paralysis, and there is prostration. Prostration means what? The motor muscles, the neuromuscular junction is not responsive. If suppose the patient is thinking that they have to lift the arm or they have to make a fist of the fingers, that would not be possible. It would take some time for them to make hold of the fist. That means what? It's an ongoing paresis. The neuromuscular junction is disturbed and the impulses which is transmitted from the brain takes time, more time than normal, to reach the particular muscle, so that the action executed is getting delayed. Okay, so all these will be the symptoms pertaining to the motor nervous system, and it can lead to a condition called as neurasthenia. So if you club all the three things together, it is called neurasthenia. Neuro means nerves, asthenia means weakness. So generally we call this as nervous weakness. So the symptoms would be paresis of the sensory nervous system, prostration of the motor nervous system, together with anxiety, bashfulness, fear, lachrymose mood, suspicion, homesickness, weak memory, depression. All these put together is called by a common heading called as neurasthenia, means weakness or prostration of the nervous system, which is put together, right? That's about the caliphos. Now coming to the natrum phos, that is the sodium phosphate. You see the location, it is present in the blood, it is present in the muscles, it is present in the nervous system, it is present in brain cells, just like caliphos. It is present in the intercellular fluids, means those fluid which is present in the extracellular component between the two cells. So these are the locations of natrum phos. And if you see the function, natrum phos has a peculiar function of decomposition of lactic acid into carbonic acid and water. Now, what does lactic acid do? Whenever there is going to be accumulation of lactic acid, then that results in a disturbance in the molecular, there is going to be disturbance in the neuromuscular junction, resulting in production of cramps. Okay. If you remember the glycolytic cycle, okay, the glycolysis pathway, we have two pathways, right? Glycolysis aerobic pathway, and next is glycolysis anaerobic pathway. Aerobic pathway will lead to the resultant production of what? Pyruvic acid or pyruvate. If there is going to be anaerobic glycolysis, matlab absence of oxygen, if glycolysis is going to go, then it leads to the production of not pyruvate, but instead lactate. So whenever there is going to be anaerobic glycolysis due to anoxia or hypoxia, in these conditions, especially in the skeletal muscles, there will be formation of lactic acid. And when lactic acid is going to get formed in the skeletal muscles, it leads to cramps. Okay. And if lactic acid is going to accumulate in the bloodstream, then it is going to lead to a condition called as acidosis, lactic acidosis. Okay. Which can even lead to a coma. Okay. Which is called as a metabolic coma. Right. So accumulation of lactic acid excessive in any of the body part, whether it be in the muscle, whether it be in the blood, is always detrimental to the human health. That is why the lactic acid has to be cleared as early as possible to prevent these complications. So what helps in lactic acid clearance? That is the natrum phos, that is the sodium phosphate. Now, what does sodium phosphate do? Sodium phosphate is going to decompose the lactic acid into the resultant component called carbonic acid and water. Carbonic acid is highly unstable. So what happens? Because of the presence of carbonic anhydrase, carbonic acid gets rapidly converted into carbon dioxide and water. Okay, two harmless products. So this is how the natrum phos is going to perform the function in the areas wherever it is going to be present. That is decomposition of lactic acid into carbonic acid and water, and carbonic acid further decomposes into carbon dioxide and water. Okay, so this process has been catalyzed, or this process has been speeded up by the presence of natrum phosphate. So this is the importance of natrum phosphate. Okay, so if there is going to be a disturbance in the molecular motion of natrum phosphate in those areas where they are located, then what happens? There is no natrum phosphate now functioning to decompose the lactic acid into carbonic acid and water. So what happens due to it? There is going to be lactic acid accumulation or excess, which is called lactic acidosis. Okay, there's going to be lactic acidosis, whether it be in the blood or whether it be in the muscles, that doesn't matter. Wherever lactic acid gets accumulated, it's called lactic acidosis. One is intracellular, second is extracellular. That's the difference. Okay. So what happens when lactic acid is going to accumulate, or when the lactic acid is going to be present in excess? When they are present in excess, or whether they are going to accumulate it, it leads to the insufficiency, or insufficiency means what? The bile and mucus with cholesterol crystals. Okay, normally when you take the bile is a a body fluid or a gastric fluid, okay, which helps in digestion, okay, which is secreted by the liver, stored in the gallbladder, getting concentrated over there, and it is going to let inside into the second part of the duodenum for the reduction of surface tension of the fats and helps in digestion of the fats. Okay, so these are the functions of the bile. So bile is having a proper proportion of organic as well as inorganic components. The bile, mucus, and cholesterol crystals, which is getting in a liquid, which is present in the liquid form or semi-solid form, okay, in the proper proportion. But if there is going to be a lactic acid excess, then that prevents this particular internal environment of the bile to be present in the semi-solid state. So what happens instead? The bile and the mucus is going to not get mixed properly with the cholesterol. So that is why that leads to the crystallization of the cholesterols, okay, which is present in the bile. So when the cholesterol is going to get crystallized, that leads to what? That leads to gallstones or cholelithiasis. So this is how the pathology develops, right? So that leads to what? That leads to complaints such as rheumatism. That leads to complaints such as dyspepsia. Dyspepsia means what? Excessive flatulence along with pain, colicky pain around the umbilical region, sensation of nausea or vomiting, okay, together with the heartburn. All these would be the symptoms of dyspepsia, excessive flatulence. Why this happens? This is because of excessive lactic acid that prevents the insufficiency of bile and mucus with cholesterol, leading to crystallization, leading to gallstone. And because of the gallstones, bile is not properly released. When bile is not properly released, the digestion of fats will not happen properly. That leads to condition called dyspepsia. And it can also lead to gastrointestinal troubles, just like I have stated, the dyspeptic troubles. Okay, and this natrum phos generally in the biochemic community, we call it as the homeopathic antacid. Okay, if any person is having excessive acidity because of excessive hydrochloric acid secretion, okay, in those people, generally in allopathy, they give the antacids such as the we have many trade medicines, many medicines under different trade names. Okay, and these are given as antacids in allopathic. Okay, whereas in homeopathy we generally have, in not in homeopathy, in biochemic system of medicine, we have the antacid of biochemic, that's the natrum phosphate, which is going to reduce the acidity from forming because of the pathogenesis what I've explained. Okay, generally people prescribe the pantocid, pantoprazole, omeprazole kind of tablets for reducing the acidity in allopathic medicine, whereas in the biochemical system of medicine, you can try the natrum phosphate. It works well, right? That's about the natrum phosphate. Fine. Now coming to the calcarea phosphorica, the calcium phosphate. If you see the location, the calcarea phosphorica or the calcium phosphate is present in the bones, blood plasma and blood cells, saliva, gastric juice, connective tissues, teeth, and milk. So what it is going to do in these areas, if you see in bones, if you see in teeth, it is going to help in structural integrity. It is going to provide the strength, or it is going to provide the strong bones and teeth, because they are considered to be the strongest parts of the human body, right? Fine. And if you see the blood plasma and cells, it is going to be present, maintaining the osmolality of this blood. And it is there in gastric juice as an inorganic component, in saliva as an inorganic component, and in milk and connective tissues, right? Through the milk, the baby is going to get the calcium phosphate, and it is going to help the baby gain the ossification of bones from the cartilaginous part. So that's the location of the calcarea phosphorica. And if you see the function, the calcarea phos is absolutely essential for proper growth and nutrition. Without calcarea phos, proper growth and nutrition cannot take place, due to which there will be not proper formation of teeth or not proper formation of bones, due to which the person can develop a condition like rickets or osteomalacia, which is due to vitamin D deficiency actually. But this also plays a role in these conditions. Okay, right. And when teeth are not formed properly, what happens? It cracks easily. There will be tendency to cavity very easily. The teeth will not be coming out at the proper time. That's the delayed dentition or abnormal dentition. So all these kinds of disturbances will happen if calcarea phos, the disturbance happens in the molecular movement of calcarea phos in the area where it has to be present. And if you see the pathogenesis, it leads to 5 different pathological conditions. First, defective nutrition, due to which the growth will not happen properly. Second is imperfect cell growth, because of which the tissue formation would not be happening properly. Third will be the death and decay of tissue, due to which the atrophy or the deadening of cells will happen. Okay, that leads to emaciation. Fine. And fourth, it leads to seroalbuminous exudation within the sacs. Wherever there is going to be a serous sac, where the serous fluid is going to be present, because of disturbance of dynamic or the molecular movement of the calcarea phos, the serous fluid will be replaced by seroalbuminous fluid. Means whitish serosanguinous fluid will be accumulated in wherever areas the calcarea phos disturbance is going to happen in the molecular movement dynamically. So that is in the serous sacs, right? So it can result in conditions like pleurisy. It can result in conditions like pericardial effusion. It can lead to conditions like the arthritis, whereby there is going to be effusion of the seroalbuminous fluid in the areas. They are called as the purulent arthritis or the septic arthritis, whereby the doctor says that the joints are enormously enlarged and it needs to be tapped very frequently of the fluids. It can lead to even the seroalbuminous exudation happening in the serous cavities of the joints, due to which the joints are enormously swollen and there happens pain. The patient has difficulty walking, sitting, standing up, and due to which there needs to be frequent or infrequent tapping of the seroalbuminous fluid which is accumulated in the big joints. So these are the pathogenesis of calcareous. And apart from that, the last one is the albumin exudation upon the surface of the mucous membrane or the skin surface can dry up to form a crust. So these are the 5 genetic action of calcareous because of disturbance in the molecular motion of calcareous in the location wherever it is present. Last is the magnesium phosphorica. If you see the location, it is present in the muscles, nerves, bone, brain, especially in the gray matter, the sperm, teeth, and the blood vessels. And if you see the function of the magnesium phosphorica, it is going to help in the structural and functional integrity, maintaining the structural and functional integrity, just like calcareous. And if you see the pathogenesis, disturbance in the molecular movement of the magnesium phosphorica can lead to contraction of muscular fibers. You see, it is a direct opposite action as compared to that of ferrum phos. If that disturbance of molecular motion of ferrum phos leads to relaxation of muscular fibers, whereas disturbance in the molecular motion of magnesium phosphorica leads to contraction of the muscular fibers. Two opposite actions, right? So here, contraction of the muscular fibers leads to what? It leads to cramps. It leads to pains which are spasmodic in nature. And third, it can lead to paralysis. So all these three are the action executed or the pathogenic action which can result from the disturbance in the molecular motion of magnesium phosphorica. So what it does, due to disturbance in the molecular motion of magnesium phos, there leads to contraction of the muscular fibers. And due to contraction of the muscular fibers, it leads to cramp, it leads to pain, which are spasmodic in nature, and it leads to paralysis. So these are the pathogenic action of magnesium phosphorica. Now, coming to the clinical indications of all the 5 phoses. If you see the ferrum phos, it is indicated in first stage of all the inflammations. Okay, because it is having congestion, which is one of the signs of inflammation. It is indicated in most of the conditions of first stage of all inflammations. It is indicated in anemia, hyperemia, hemorrhages, which are bright red and which coagulates easily. It is also used in mechanical injuries for inflammation, for dropsy. Dropsy is what? Generalized swelling of the body because of excessive accumulation of water. Varicose veins, sprains, fractures, if soft parts are wounded. Okay, it is indicated in fractures, not for the bones fractures, along with the complicated fracture. If suppose the bone is going to injure, the broken bone is going to injure the soft tissues. In that case, you can use ferrum phos along with calcareous, where calcareous will help in healing up or joining of the fractures, the ossification of the fractured part. Okay, and the second thing, that's the callus formation we say. And the ferrum phos is going to help in healing of the soft parts which are wounded by the fracture, or it is called as the osteitis first stage. Okay, and next is glandular ulceration. In all these conditions, you can think of ferrum phos. Why varicose veins? I told you, wherever the ferrum phos is present, if there is going to be disturbance of molecular motion, it leads to a condition called relaxation of the muscular fibers. And when muscular fibers is relaxed, what happens? There is going to be pooling up of blood, which is called the varicose vein. So it is one of the medicines given for treating the varicose veins in the biochemic sphere of healing, right? Next, when coming to caliphos, if this is a clinical indication, it is indicated in anemia, emaciation, atrophy, wasting diseases, septic hemorrhages, gangrenous conditions, scurvy with gangrenous conditions. In all these conditions, you can think of caliphos. If you see natrum phos, it is indicated in exudations and secretions which are yellow, honey colored, leukemia, marasmus of children, itching all over the body, swelling of lymphatic glands before hardening takes place. If hardening takes place, you should think of calcarea fluor. Before hardening takes place, if there is going to be swelling of lymphatic glands, you can think of natrum phosphorica, right? Then in conditions of rheumatic arthritis, in all these conditions, natrum phos can be thought of. We see calcarea phos, it is indicated in anemia and chlorosis, bone diseases such as exostosis, whereby excessive bone is going to get formed, osteophytes formation, non-union of fractures, rickets, nasal polypi or nasal polyps, rectal and uterine polyps, goiter, cyst, and tumors. So in all these clinical conditions, you can think of calcarea phos to be remedied. Last is magnesia phosphorica. It is given in clinical conditions of spasms, neuralgias, chorea, tetanus, spasm of glottis, nervous asthma, spasmodic retention of urine, epilepsy, and paralysis agitans, which is called as the Parkinson's disease. In all these conditions, you can think of magnesia phosphorica. Right. Now coming to the next group, which are the muriaticums. Okay, phosphates are over. Now coming to muriaticums. Now in muriaticums, we have two mures. One is kalimure, or the potassium muriaticum, potassium chloride, and second is the natrium mure, called the commonly called as the common salt or the sodium chloride. If you see the location of kalimure or the potassium chloride, it is present in blood cells, muscles, nervous tissues, brain cells, and it is specifically given that no new brain cell formation would occur without the presence of potassium chloride. So if potassium chloride is not present, no new brain cell formation would be happening. That is why it is very, very essential for new brain cells to form. And next is, it is in the intercellular fluids. That means the fluid present between two cells. If it is a function of the potassium chloride, it is related closely to sodium chloride. So whatever functions sodium chloride does, potassium chloride takes one of the functions or helps in executing one of these functions. And the functions include protection of the cell, keeping the blood serum at uniform specific gravity. It regulates the osmosis. It maintains the moisture within the cells. So all these are the functions of sodium chloride and potassium chloride put together. And if you see the pathogenetic condition, if there is going to be disturbance in the molecular movement of the potassium chloride, it leads to a condition of fibrinous exudation. What is fibrinous exudation? Have you studied this crocus sativa medicine in homeopathy? Have you studied the Kali bichromicum medicine? Have you studied the Kali carbonicum medicine? All these medicines have stringy discharges. Stringy discharges means the discharge which can be taken as long strings. Crocus sativa has this. When the menstrual bleeding happens, this can be drawn into long strings. Similarly in Kali bichromicum as well as in Kali carb, in some of the conditions, you can see that the discharges from the nasal or from the throat or from the lungs, wherever it be, it can be taken as a long string. These are called as a fibrinous exudation, like a fibrin thread, whitish or yellowish white in color. Okay. Likewise, wherever the kalimure disturbance of molecular motion is happening, in those cases, in those areas, there will be fibrinous exudation, which can be whitish or whitish gray in color. And this further leads to formation of a blister. Blister means what? A skin condition whereby there is going to be a formation of a vesicle or a bullae, okay, inside which it is going to contain water or coagulated pus-like secretions. Okay, so this is called as a blister formation. Fine. Actually speaking, blister contains a serosanguinous fluid or serous fluid, which further, due to septic conditions, can turn into an abscess. So you say abscess when there is going to be infection together with pus formation. Whereas in blister, the pus has not yet found. It is in the first stage, whereby there is going to be present of the serous fluid or the serosanguinous fluid inside. Okay, and this fibrinous exudation can be present inside the blisters, right? So these fibrinous exudations on the surface of the skin or the mucous membrane, when it is going to get dried up, it is going to become like a mealy eruption. What is mealy eruption? When the starchy fluid, when you're going to prepare a meal, when you're going to take the excessive water out of the meal, out of the rice when cooking, after cooking, when you're going to decant it, when this particular starchy fluid is going to get coagulated or dried up, it becomes like a starchy mealy eruption. Likewise, when the fibrinous exudation is going to dry up, it is going to resemble like a mealy eruption. Right. So that's about the Kali muriaticum pathogenesis. When coming to the natrium muriaticum or the sodium chloride, you can see the location. The constituent of every liquid in the body, human body, contains sodium chloride. About 0.7% of the plasma contains sodium chloride. And apart from that, the solid part of the body, the cell protoplasm composition is going to have the proper composition of 100 molecules of sodium, 2.2 molecules of potassium, 1.5 molecules of calcium. Professor Dr. Loeb has discovered by his experimentation and research that every cell to be viable should contain the proportion in this proper proportion. That is 100 molecules of sodium, 2.2 molecules of potassium, 1.5 molecules of calcium. If this proportion is going to change, if there is going to be increase in one, decrease in other, then the cell becomes non-viable and the cell bursts up. The cell membrane together with the cytoplasm cannot able to sustain if this proportion is changed. And that much important is the proportion of the sodium in this particular cell. 100 molecules of sodium, 2.2 molecules of potassium, and 1.5 molecules of calcium. This is discovered by Dr. Professor Loeb in his experimentation or research, that every cell is composed of this composition, right? If you see the function, it helps in the protection of the cell. It keeps the blood serum at uniform specific gravity. It regulates osmosis. It maintains the moisture within the cell. If you see the pathogenesis of natrium ureaticum, if there is going to be disturbance in the molecular motion of natrium ure in whatever location it is going to be present, then that results in intracellular retention of water. So wherever sodium is present, then the water gets accumulated, right? That is why in patients who are having hypertension, doctor would generally recommend as a diet to have a low sodium salt. Why low sodium? Because if the patient who is having hypertension or who is in the verge of getting hypertension is going to take more amount of salt, then the excessive salt gets accumulated in the body. Along with salt, water retention happens. When water retention happens, the blood volume is going to get increased. And when the blood volume increases, the cardiac output increases and the stress is given to the myocardium of the heart to pump out all the blood in a stroke volume. So already the heart is in the hypertrophy, cardiac hypertrophy because of the hypertension. So when much load is going to get given to the heart, then that results in a cardiomyopathy, hypertensive cardiomyopathy. For that reason, the doctor would generally recommend to reduce the amount of salt. And it is also hold true in patients who are having CKD, chronic kidney diseases, to limit the salt intake, right? Fine. So here, the intracellular retention of water happens because of which two things happen. If the cell is going to retain much amount of water, then that results in a condition called dropsy and edema. Edema means what? Localized accumulation of fluid, okay, in any of the body parts, especially in the dependent parts of the body. Okay, the edema is again divided into two types. One is called pitting edema, second is called non-pitting edema. In pitting edema, when you're going to apply pressure externally upon the bony surfaces of the skin, then there is going to be a pitting of the thumb impression or the finger impression wherever you're exerting your pressure. That's called a pitting edema. And non-pitting edema means you don't have the pitting happening, and it generally happens in certain conditions like filariasis. Okay, and in the hypothyroidism. Okay, in hypothyroidism, whenever there is going to be accumulation of the the proteinaceous material in the pretibial region of the leg, that's called the pretibial myxedema. In myxedematous condition, because of proteinaceous accumulation, it resembles like an edema, but it will not pit upon pressure because it is not, fluid is not present. Instead, proteinaceous matter is present. The myxomatous material is present. That is why in myxedema and as well as in elephantiasis or filariasis, you have non-pitting edema. Rest of the edema, like the cardiac edema, renal edema, in all the inflammatory edemas, all these are pitting edemas. That's how you differentiate the edema, right? Fine. Next is the dropsy. What is a dropsy? Dropsy is a generalized swelling of the whole body. It's called anacerca. It's a old terminology. And the dropsy is actually a whole terminology. Anacerca is a new terminology what we use in pathology. And this generally happens in a condition like nephrotic syndrome, whereby the whole body is swelled up. It also happens in conditions like liver failure or the right heart failure. In these conditions, you have the anacerca or the dropsy. Okay. So this is there as a resultant of intracellular retention of water. And because of intracellular retention of water, what happens? The skin surface is not getting the fluid which is to be present. That is why, due to lack of moisture beneath the epidermis, there happens dandruff and blister formations. Just like your calium ureaticum, here also you have the blister formation. And dandruff. Why dandruff? The moisture is not present. So what happens? The epidermis and dermis is going to separate. When the epidermis and dermis separates, what happens there? Epidermis is going to have the 5 layers, right? Stratum, spinosum, the basal layer, the topmost layer is called the corneal layer. Okay, so because of the separation of stratum corneum from the stratum spinosum, what happens? There will be peeling of the the dandruff, the scales from the scalp. That's called the dandruff formation. And that happens because of lack of moisture. Why? Because of intracellular retention of water, there is going to be a dropsy and there is going to be lack of moisture beneath the epidermis. Okay. Right. And because of lack of moisture, there is going to be incessant thirst. The thirst is increased to replenish the water which the skin surface is lacking. Okay. Fine. That's about the pathogenesis of natriureure. Now coming to the clinical indications. In calimure, I told you ferrum phos is indicated in the first stage of inflammation. Remember? Because of the congestion present and because of relaxation of the muscular tissues, due to which the congestion and the heat is going to happen. Here, calimure is indicated, the potassium chloride is indicated, the deficiency is indicated in second stage of inflammation. So in second stage, what happens? Exudation happens in second stage of inflammation. Exudation of a plastic or fibrinous character. I told you the seroalbuminous secretion. So all this happens here. Okay. The fibrinous secretions. Anemia, dropsy, hemorrhages which are dark, black, and clotted. Remember, in ferrum phos, you have the blood which is bright red and easily coagulated. Whereas here in calimure, we have hemorrhages which are dark, black, and clotted. Right? Glandular swellings, follicular infiltrations, scurvy. Second remedy in sprains, strumous condition. Strumous condition means easy swelling of the glands because of excessive exposure to or exposure to cold in general. We have the epismell in homeopathy for the strumous diathesis. Likewise here in calimure, we have the strumous conditions. Easily swelling of the lymphatic glands or generally the glands in general, upper respiratory, because of the easily exposure to the colds. And if you see the natrium ureticum, it is indicated in anasarca, dropsy, serous or watery exudations, anemic conditions where the blood is thin and watery. In chlorosis, diabetes, Bright's disease, cachexia. Cachexia means what? Emaciation. Okay. Excessive emaciation. It's called cachexia. Together with any advanced disease conditions, that's called cachexia. In cancerous conditions, advanced cancers, or else in advanced stage of diabetes together with emaciation, or else in tuberculosis, or else in case of malnutrition diseases, together with excessive weight loss. In these conditions, they are called as cachexia. In gout, dryness of mucous membrane with erosion, weakness, headache, mental confusion. So all these are the clinical conditions in which natriureure can be given as a biochemic salt for treatment. Now coming to the sulfates, the third class, that's the sulfates. So we have three sulf here: calcarea sulf, natrum sulf, kali sulf. If this is the calcarea sulf, the location is in the bile. That's why I told you the action is very limited of calcarea sulf. That is why I told you Schuessler has removed calcarea sulf in the last editions of his tissue remedies just before his death. Right? If you see the functions, calcarea sulf in liver destroys the effete RBCs. Effete RBCs means when the RBC's lifespan is over. When 120 days has been completed by RBCs, then they becomes effete. They are called as senile RBCs, and these RBCs are destroyed by the dehydration. They are called as piclosides, and they are destroyed by the reticuloendothelial cells, which are called the Kupffer cells present in the liver, and it is broken down into heme and globin. So this is how the RBC destruction is happening, and for that, calcarea sulf is essential. If you see the pathogenesis, the destruction of effete RBCs is delayed because of the disturbance in the molecular motion of calcarea sulf, due to which the blood contains plenty of effete RBCs which are not being destroyed. And these effete RBCs reach the mucous membranes on the skin, and upon reaching the mucous membranes on the skin, they form the catara and eruptions. Okay, and separations means pus formations with a vent. Abscess, when it is going to have a vent or a hole through which the pus comes out, that is called as the abscess with a vent, right? And when you see the clinical indications, calcarea sulf is indicated in abscesses, serous swellings, cystic tumors, malignant growths after ulceration has set in. Whenever there is a cancer whereby the ulceration has developed, you can think about calcarea sulf. Okay, right. When you come to the natrum sulfuricum or natrum sulf, the location is in the intracellular fluids. Between the cells, those extracellular fluid which is present between the cells are called intracellular fluids. If you see the functions of natrum sulf, it aids and regulates the excretion of superfluous water. Excess water has been removed from the body with the help of natrum sulf. So it is having a diuretic action. Okay, removal of excessive water from the body. those water which are excess in number or excess in quantity. If it's a pathogenesis, if there is going to be disturbance in the molecular motion of the natrium self in those areas or locations of intercellular fluids, then there happens accumulation of superfluous water. That means natrium self performs the functions of removal of excess water. If that is not there, then what happens? Excessive water is going to get accumulated. That leads to what? Dropsy, just like your natrium ure. Okay, right. When you see the indications, clinical indications, it is indicated in edema, smooth swellings, infiltrations in a hydrogenated constitution in whom the accumulation of water is very easily happening. And next is pyemia, septic conditions whereby there is pus accumulations. Okay, that's about the natrium self. Now coming to the last, kali self or potassium sulfate. The location is in the epidermis and the epithelium. The function is it is going to act like an oxygen carrier along with ferrum phos. I told you when I was teaching you the ferrum phos even. Ferrum phos together with kali self is going to act like an oxygen carrier to help in the carrying of oxygen to those areas wherever oxygen is essential. So if there is going to be a disturbance in the molecular motion of potassium sulfate, it leads to three conditions. First is epithelial or epidermal desquamation. The cell breaks up. The epithelium breaks up, just like your natrium ure. Okay. Next, there is going to be yellow slimy deposit on the tongue, which can be seen very easily in tongue diagnosis. Last is there is going to be watery, slimy, thin or decidedly yellowish or greenish discharge and secretions from any mucous membranes. So there is going to be greenish discharge, just like your calichloroatum, just like your pulsatilla, just like your just like all these medicines, you have the calisulfuricum, whereby you have the greenish, yellowish discharge. Okay, just like your heparsulf even, greenish, yellowish discharge from any mucous membranes wherever there is going to be having a secretion. So these are the pathogenesis of calisulf. And remember, this is given in the third stage of inflammation, right? So calimure in the second stage, ferrum phos in the first stage, calisulf in the third stage of inflammation. So in third stage of inflammation, where there is evening rise in temperature, aggravated by heated room, amelioration by cool open air, just like your pulsatilla. That is why calisulf is the chemical analog for pulsatilla. You might be reading in the Allen's keynotes, right? Calisulf is the chemical analog of pulsatilla, or the vegetable analog of calisulf is pulsatilla, likewise. Okay. Now coming to the last two medicines. These cannot be grouped together because their anions is different. This anion is different. So we'll read as separate ones only. One is the Calcarea fluorica, second is the Silesia. Okay, now if you see the location of Calcarea fluor, it is in the surface of the bones and enamel of the teeth, just like Calcarea phos. It's a constituent of elastic fibers such as skin, connective tissue, vascular walls, and it is there in the epidermis. When you see the function of Calcarea fluor, it maintains the structural integrity and functional integrity wherever it is present in these locations. When you see the pathogenesis, if there is going to be disturbance in the molecular movement of Calcarea fluor in these locations, that leads to relaxation of the elastic fibers, just like your ferrum phos. Okay, ferrum phos is muscular fibers, remember. But here, Calcarea fluor is relaxation of the elastic fibers. So when there is going to be relaxation of the elastic fibers in the blood vessels and lymphatics, in blood vessels, because of relaxation of elastic fibers, it leads to continuous dilatation. When there is going to be continuous dilatation of the blood vessels, it leads to a condition of induration. Induration means what? Swelling. Okay, aneurysm. All this happens because of continued dilatation of blood vessels. That's an aneurysm, right? Or else it can lead to induration, leading to varicose veins formation, relaxation of elastic fibers, leading to varicose veins formation. So this is the Calcarea fluor due to dilatation of the blood vessels. So if lymphatics is going to get dilated because of relaxation of elastic fibers, it leads to non-absorption of exudates. So if exudates are not getting absorbed, what happens? It leads to induration again. Okay, a non-absorption of exudate can lead to keratin exudates. Keratin exudate means hard exudates, okay, which are having a sticky and which are having a hard nature. They are called keratin exudates. Just like those exudates which comes out of your sebaceous cyst, just like those exudates that comes out of a sebaceous horn, or just like those exudates that comes out of an acne or a pimple. So all these are keratin exudates only, right? And that leads to a hard, knotty exudation on the surface of the bones. That is why you have the exostosis. That is why you have the excessive bone formation. That is why you have the osteophytes formation. So all these excessive bone formations are due to non-absorption of exudates by the lymphatic system, due to the formation of hard, knotty exudation on the surface of the bone. Clear now? So generally people give Calcarea fluor for tumors, or for any kind of exostosis conditions of the bones, or for reducing any kind of tumors. Why the tumor happens is because of this. Because of relaxation of elastic fibers due to non-absorption of exudate, that leads to a hot knotty formation on the surface of the bones or on the surface of tissues even, right? So that's about the calcarea floor pathogenesis. Now coming to the Silesia, the location, if you see, it is in the ashes of the blood. Okay, it is in the bile, it's in the urine, it's in the epidermis, it's in the hair, it's in the nails, it's in the connective tissues, it's in the nerve fibers. These are the functions. It maintains the structural and functional integrity of those cells wherever it is being present. Now, what happens in the pathogenesis? Because of disturbance in the molecular motion of Silesia, there happens turgescence of the cells of turgescence means what? It is going to get shrunken. Turgescence means rigidity. When turgescence of the cells of connective tissue happen, that leads to atrophy of these particular cells, and atrophy of these cells leads to separation and pus formation. So what happens? The dead cells together with the pus is good. The debris of the dead cells together with the WBCs which has been involved in the inflammatory process as a macrophages, that leads to pus formation, right? And turgescence of the cells of connective tissue leads to malnutrition, that will also add up to the separation and pus formation. So any septic conditions whereby the pus is thick and yellowish in appearance, thereby Silesia is indicated, right? So that's about the calcarea floor and Silesia. Now coming to the last slide regarding the clinical indication of calcarea floor and Silesia. Calcarea floor is indicated in osseous growths, dropsy caused by heart disease, ganglion, cystic tumors, caries and necrosis, ulceration of the bone or enamel, indolent ulcers. And Silesia is indicated in bleeding abscesses with fistulous openings, inflammatory swelling, ulceration and necrosis of bone, enlarged separating glands, dropsy, malignant and gangrenous inflammations. So generally we have a dictum in biochemic medicines that whenever there is a pus formation, whenever there is an abscess, try to give Silesia. Okay, Silesia will mature up the abscess and it will help in the formation of a vent. And when a vent is going to form and when the pus is going to start coming out, then you shift over from Silesia to calcarea sulf. Okay, calcarea sulf will remove all the pus and then it will help in the healthy healing of wounds. And when all the pus has been come out, then you can give ferrum phos for healing of this particular abscess. This is the general dictum what we generally follow in biochemic medicines. So that completes the 12 tissue remedies. I hope it's clear to you. Thank you all. If you have any doubts, you can ask me. I will stop sharing my screen.
Doctor,
yeah,
very nice presentation and very depth in knowledge. So your hard work for to describe all these things in within an 50 minutes. That was great because you are included all this. So top to bottom of
thank you, sir.
the characteristics are here. And I asked you, sir, why I am using calcarea sulf more for all these conditions, for this, for the whatever the conditions you told. Why they are separated that it should be not included in the salt,
The
salt.
yeah, nice question, sir. But we don't know the exact reason why. But as far as the books I have referred, it is given that in the initial days of Schussler, when he was about to form the system of biochemic medicines, he was having 12 tissue remedies, the one what I have explained now. But almost at the end, he thought that calcarea sulf is not having much role in the body system because it is present only in the bile and its action is only up to the destruction of the effete RBCs, the destruction of the RBCs only. So he thought that this is a function of some of the cells of the liver Kupffer cells probably, and calcarea sulf is having only very limited action. So that is why he removed this altogether. But the authors like Dr. Boric and Dr.D.BALACHANDRAN, okay, they have included these particular retained these particular calcarea sulf in their explanation of this particular tissue remedies. If you try to buy books from BJN publishers, which has been in the circulation now in markets, that will not have calcarea sulf. They'll be having only relevant medicines. Calcarea sulf has been accepted because they strictly follow Schussler's last edition, just like we follow the 6th edition of Organon, right? That was the last edition written by Hahnemann. There are some who follow the 5th edition because that was written before his death. And there are few who follow 6th edition. They might say that there has been some inclusions by those apart from Hahnemann, so it is not considered authentic likewise. So the battle still happens whether 5th or 6th edition is the final book to be followed or not. There are certain grand old practitioners who follow only 5th edition. There are certain practitioners, or generally what we recommend in colleges is the 6th edition. So likewise, the biochemic system is now split into two, whereby there are those who follow the 12 tissue remedies, and there are those who follow the 11 tissue remedies because the last Calcarea self has been accepted by Dr. Wilhelm Schussler just before his death. So that is why you cannot find Calcarea self in the recent text, what has been coming out in the biochemic system. But if you read the grand old textbooks, the previous editions of Dr. Schussler, the 12 tissue remedies of Dr. Schussler, and as well as the books written by Dr. Boric and Dr. Dewey, then Calcarea self is definitely there because Calcarea self is having definite action. It is not like it is going to resemble any other remedies. Its action and its pathogenesis is completely separate, and it cannot be correlated with similarity with any other medicines. That is why Calcarea self is characteristic and Calcarea self should be present. And the reason what Schussler has given for removal is this, that Calcarea self's action is very limited and it is only pertaining to the bile or the liver, the presence in bile. Because if you see other medicines, they are present in multiple areas of the body, no? Nervous tissues, blood cells, okay, intercellular tissue spaces, okay, the brain, likewise the body fluids, likewise all these areas are present. But if you see Calcarea self, the actual location is given only in the bile. So he thought that this action of Calcarea self is very limited only to bile. So why to include? Why not to exclude? So this might be his mental process before removing Calcarea self before his death. So I hope I answered your question rightly.
Thank you, sir. Thank you.
Yeah. Yeah.
But hemolysis, it helps hemolysis. That is a great thing.
Yeah.
In our
FeT
day-to-day
distillation of
practice, it is
FeT.
a great thing. Otherwise, for this small rashes and everything, only cured with this medicine, a few doses of this medicine.
Yes.
Now, anybody want to ask questions? Please raise your hands, then I shall allow you. Nobody asking. Doctor, I ask you, nobody is asking. So if we are using in a complex form, that is in combinations, it may any adverse result may happen.
No, sir. See, in homeopathy only we have a dictum that medicine should be given singly. That's the law of minimum dose and law of simplex. One simple single medicine should be given at a time. There should not be any combination of medicines. That's what Hahnemann has said before his death in 6th edition even. But here in biochemic medicines, there is no such dictum like the medicine should not be mixed together. That is why we have the authentic biocombination, which is given by Dr. Schussler himself. It is not, the combinations are not given by other people. Even I have a friend who practices only the single biochemic medicines. He will give only 12 tissue remedies separately, not together. But we have biocombinations from 1 to 28. All these are complementary actions. Basically, the homeopathic medicines are proved. There is a human drug proving happened. And these medicines are proved as a single medicine. That is why we give as a single medicine while practicing. Whereas biochemic medicines are never proved. Keep that point in mind. There are no human provings. These are only clinical observations, what Dr. Schussler has observed. And depending upon this clinical observation, he has found out that these diseases are resultant because of deficiency in the salt in the molecular motion. And that has to be supplemented by this biochemic medicines. This is the dictum. And he is the only person who has even recommended the biochemic combination, because you can see there are certain salts which is having a common location. Right?
Thank you,
Natrium,
sir. Thank you.
kalium, likewise. Yeah.
Thank you, sir. Now, it was a great lecture.
Yeah.
Thank you all. Now we are, for the time is almost completed. So very much thankful to you. We are very much grateful to you. Come again with another topic. Okay, then, Doctor. Now we are passing to our Malayalam session. Thank you all for watching this program. Now I invite Dr. Shaila to moderate the Malayalam session.
Thank you.
Thank you, Dr. Balendra. And make you
ഡോക്ടറെ എന്നെ ഒന്ന് co-host ആക്കി.
ആക്കി കഴിഞ്ഞു.
Okay, thank you, Dr. Hubert. Thank you all doctors in English session. നമസ്കാരം. ഇന്ന് IFPHന്റെ ഇടതടവില്ലാതെ തുടർന്നു വരുന്ന വെബ് പരമ്പരയുടെ 1345 ദിവസം. ഇന്ന് മലയാള സെഷനിൽ ഇന്നലത്തെ ക്ലാസ്സിന്റെ തുടർച്ചയാണ്. നമുക്ക് ഇന്നലെ ക്ലാസ് എടുത്തിരുന്നത് ഡോക്ടർ PS ബേബി ചക്രപാണി. അദ്ദേഹം ക്യുസാറ്റിലെ ബയോടെക്നോളജി വിഭാഗം ഡയറക്ടറാണ്. ഇന്നലത്തെ ക്ലാസ്സിന്റെ തുടർച്ച തന്നെയാണ്. ജീവിതശൈലിയും തലച്ചോറിന്റെ ആരോഗ്യവും എന്നുള്ള വിഷയത്തെ കുറിച്ചായിരുന്നു ഇന്നലെ ക്ലാസ്. നമ്മുടെ ജീവിതശൈലി കൊണ്ട് എങ്ങനെ നമ്മുടെ